Chapter 27, Part 2, Female Reproductive System. Table of Contents. The major organs. So there are internal and external genitals. Internal genitals for females are located inside of the pelvic cavity, and they include ovaries, right here and here they are, uterine tubes connecting them to the uterus, here are the uterine tubes, right here, the uterus, and vagina. External genitals include mons pubis, it would be right here, a pad of fat that is located at the anterior over the pubic bone. Labia majora, folds of hair-covered skin, and labia minora, those are two folds of the skin that are thinner and more pigmented folds located medial to the labia majora, and they protect female urethra and openings to the vagina. Then clitoris, an organ that is important in sexual sensation. Hymen would be a thin membrane that sometimes partially covers the entrance to the vagina, vaginal opening, and openings of the Bartholin's glands that are located next to vaginal opening. Vagina is a muscular canal which is approximately 10 centimeters long, and it's the entrance to the reproductive tract. It also works as an exit from the uterus for menstrual blood and for the childbirth. Hymen can partially surround the opening to the vagina and can be ruptured with physical exercise, sometimes intercourse, and childbirth. The Bartholin's glands secrete mucus, which keeps the vaginal opening area moist. And finally, in the vagina, there is a population of microorganisms called lactobacillus, which is completely normal. They help to protect against infection by pathogenic bacteria or yeast infection or other organisms. How they do it? They secrete lactic acid, and that protects the vagina by maintaining acidic pH, which is below 4.5. Ovaries. The ovaries are female gonads. Remember what gonads are. It means they produce cells, ova or eggs, and they produce female reproductive hormones. The ovaries are paired organs, left and right, and approximately each of them is 2 to 3 centimeters in length. They are located inside of the pelvic cavity, and they are held by ligaments. Suspensory ligaments, right here, connects ovaries to the walls of the pelvis on the sides. Next one, mesovarium connects ovaries to the broad ligament right here on the top of its broad ligament. And finally, ovarian ligament, this one, connects an ovary to the uterus. Blood supply for the ovaries would be ovarian arteries and the ovarian branch of the uterine artery. So 2 arteries. Ovarian surface epithelium right here covers the ovaries. And also under the surface epithelium there will be tunica albuginea, connective tissue layer. There are 2 regions inside of ovaries: cortex, that outer region, and medulla, where mostly there will be blood vessels and nerves. Eggs or oocytes develop within the cortex. Here you see oocytes on different stage of development. And each of them is surrounded by supporting cells. So, oocyte and supporting cells surrounding it, that would be oocyte, those would be supporting cells. Together, it's called a follicle. Before you continue, please answer the questions for part 2.1. Now let's talk about ovarian physiology. So, monthly changes happening in the ovary are called ovarian cycle. Days right here, it's all about a period. Day 1, it's a day when the period starts. So there are two phases if we think that on average the cycle is 28 days between the periods. The first one would be follicular phase, days 1 to 14. That's when a follicle is growing inside of the ovary. Ovulation then happens when that follicle is expelled, the egg is expelled out of the follicle, out of their ovary. And finally, luteal phase, days 14 to 28. Oogenesis, or formation of the egg or ovum. That is a process of production of female gametes, oocytes. It all starts in the fetal period. Please pay attention. The girl is not born yet, but in her tiny ovaries, in that fetus, female fetus, already there is a process calling oogenesis starts. First of all, the stem cell called oogonium divides into two primary oocytes. One of them becomes oogonium itself for next division. The process itself was just simple mitosis. So we have a cell with 46 chromosomes right now, and it's called primary oocyte. After that primary oocyte starts meiosis, the next division, and it all happening before birth, and it freezes, it stalls in prophase 1. So meiosis stops. Next one, the girl is born, she is growing, and only after she reaches puberty at 10, 12, 13 years old, that process continues. So each month after puberty, a few primary oocytes are activated. So those primary oocytes, one of them will be activated to resume meiosis. So it continues and it divides into two cells. First, polar body. That's a small cell. It won't participate in anything. It can sometimes divide and form two second polar bodies, but finally those will degrade. And secondary oocyte. Here it is. The secondary oocyte starts the second division, meiosis 2, and also stops in metaphase 2. And that division, meiosis 2, will continue only in case if that secondary oocyte will be penetrated by the sperm cell, which is called fertilization. So only if fertilization happens, the second oocyte finishes its division, forming ovum, the functional gamete, and the second polar body. So how those follicles are growing inside of the ovary? During the follicular phase, remember, that's from day 1 to day 14. So inside of the ovary, there are ovarian follicles. Here it is one of them. Inside there will be an oocyte or egg and supporting cells. This one is primordial follicle. They are present in newborn females. Those are tiny structures with an egg inside and surrounded with one thin layer of flat cells. They are called granulosa cells. So one layer of flat cells. After puberty, every month a few primordial follicles will respond to a recruitment signal every day, and they become primary follicles. How primary follicle is different? There are still egg or oocyte inside, and right now it is surrounded with one layer, but those already will be cuboidal cells. Folliculogenesis continues, and in a while primary follicles become a secondary follicle. So a secondary follicle already has more than one layer of those granulose cells, and it also develops a second type of cells, which are called theca cells. Cells that work with granulose cells to produce hormones, estrogens. Next one, that secondary follicle becomes a late secondary follicle, or in some books like yours it's called tertiary follicle. Now there are several layers of granulose cells surrounded by theca cells producing estrogen, and inside there will be oocytes with formed zona pellucida around it. That zona pellucida starts forming fluid. That fluid accumulates, forming one large pool called antrum. And finally, only one of those tertiary follicles every month becomes a vesicular follicle. It means the antrum becomes really huge. That follicle, vesicular follicle, bulges from the external surface of the ovary, and finally it continues to growing until ovulation, or rupturing of the follicle and releasing oocyte surrounded with some granulose cells. That would be ovulating follicle. So ovulation itself, it's when ovary wall ruptures and secondary oocyte is expelled with surrounding cells. You remember those are granulose cells, but now they are called corona radiata. Some women feel some pain during ovulation, others do not. And about 1 or 2% of ovulations release more than one secondary oocyte. 2 usually, and that can result in fraternal twins, not identical twins. After ovulation, the second part of the ovarian cycle will be luteal phase. That ruptured follicle collapses, granulose cells and internal sickle cells form corpus luteum. That what happens inside of the ovary, corpus luteum, and it starts producing progesterone and estrogen. What happens with that corpus luteum further depends if there is pregnancy or not. If there is no pregnancy, within 10 days, corpus luteum will degenerate and becomes tiny corpus albicans. Here it is, one of those. Small scar tissue. But if pregnancy starts, then corpus luteum keeps being large and produces hormones until the placenta takes over at about 3 months of pregnancy. Hormonal control of the ovarian cycle. It all starts from puberty, when hypothalamus is activated and starts releasing gonadotropin releasing hormone, which goes to the anterior pituitary and makes it to produce follicle stimulating and luteinizing hormones. Both of them act on the ovaries, and the first period happens. It's called menarche. Later, hypothalamus and pituitary continue regulating the ovarian cycle and ovulation. Gonadotropin-releasing hormone will be activating luteinizing and follicle-stimulating hormones released from anterior pituitary. And those two hormones go to the ovaries and stimulate the production of estrogen and progesterone by the ovaries. The amount of those hormones depends a lot on their phase of the cycle. For example, during follicular phase of the ovarian cycle, both luteinizing and follicle-stimulating hormones stimulate follicles to grow, and in the uterus at the same time, endometrium starts thickening, layer of the uterus. Later we'll talk about it. Next one, during ovulation, again, luteinizing and follicle-stimulating hormones stimulate maturation of one of the growing follicles, which later ovulates. And ovulation will be triggered by the surge increasing of the level of luteinizing hormone. Finally, during the luteal phase, luteinizing hormone stimulates formation and maintaining of the corpus luteum, and corpus luteum secretes progesterone, which causes several changes in their uterus, which we will be talking about a little bit later. So before you continue, please stop the video and answer the questions for chapter 27, part 2.2. Female duct system. Female duct system is made of uterine fallopian tubes that start closer right here to the ovary and go all the way and open to the uterus. Here it is, another one. Then uterus itself and vagina. Uterine tubes start from the wide part right here called ampulla, and distal expansion of ampulla with infundibulum, right here infundibulum, has fimbria, finger-like projections. So those are finger-like projections, fimbria, that is wider part, infundibulum and ampulla, and that is usual site of fertilization in the ampulla. The purpose of fimbria is to create a current to move oocyte released from the ovary during ovulation into the uterine tube. Those fimbria grab it and move it along the tube. Next one, close to the uterus there will be a narrow part called isthmus where a tube joins uterus. And oocyte will be carried from here into the uterus by peristalsis. Uterus is made of the body of the uterus, the mid portion, isthmus, narrow region, here it is, and cervix. Inside of the cervix, there will be some cervical glands that secrete mucus, and that mucus blocks sperm entry except during mid-cycle when ovulation happens. The top part of the uterus is called fundus. Uterus is supported by several ligaments. Lateral ligaments, they are also called lateral cervical or cardinal ligaments, go from the cervix right here they are, and superior part of the vagina to the walls of the pelvis, left and right. Uterosacral ligament goes from the uterus back to the sacrum. Here it is. Actually, it's uterosacrum, but in this picture, for some reason, it's sacrouterine. Same thing. From the back, posterior side of the uterus to the sacrum. Finally, there are round ligaments. They go all the way from the uterus to the anterior part of the pelvic cavity. Uterine wall is made of 3 layers. Inner layer right here is called endometrium. Then we have a thicker layer of smooth muscle called myometrium, and finally outer layer of serous layer of connective tissue is called perimetrium. Endometrium itself is made of 2 layers. That would be from the outside. So the first will be functional layer and basal layer. Basal layer is always there. Functional layer changes in response to ovarian hormone cycles. It's shed during menstruation and removed this layer, which causes bleeding, but basal layer or stratum basalis later will build new functional layer when the period is over. Uterine vascular supply. Both uterine arteries, left and right, arise from internal iliac arteries. As soon as uterine arteries enter the uterus and go into their myometrium, they give branches to several arcuate arteries. Here's one of them. Arcuate arteries give branches that are called radial. So radial branches now go into the endometrium and they divide into straight arteries. Straight arteries stay in the basal layer. And spiral arteries. Spiral arteries go all the way to the functional layer of endometrium. And when it's time for the period to start, the spasm of spiral arteries causes this layer of tissue, functional layer, to die and be shedding of the uterus, causing bleeding. Before you continue, please stop the video and answer the questions for Chapter 27, Part 2.3. Now we will talk about uterine cycle, or it's also called menstrual cycle. So what is that? That is a series of changes that happens inside of the uterus, in endometrium primarily, where the functional layer is shed and then rebuilds and prepares for implantation. And those cyclic changes happen in response to ovarian hormones. And there are 3 phases. So days 1 to 5 on average, that would be period, menses or menstrual phase. That's when the functional layer of endometrium is shed. Days 6 to 14 would be proliferating or pre-ovulatory phase. That's when functional layer rebuilds. And finally, days 15 to 28 is called secretory or post-ovulatory phase. It's when that functional layer prepares for implantation of the embryo in case of pregnancy. So first, the menstrual or menses phase. The level of hormones is relatively low. Both follicle-stimulating, luteinizing, estrogen, and progesterone level is low. And decline in progesterone especially, that's what's important, that triggers the shedding of stratum functionalis of the endometrium. Next on proliferative phase happens when tertiary follicles begin to produce estrogen. Here it is, the level of estrogen increases. This rise in estrogen levels stimulates the endometrial lining to rebuild. So functional layer rebuilds. And right before the ovulation, the 14th day, the surge of the luteinizing hormone triggers ovulation. So on average, ovulation happens on the 14th day, if the cycle is 28 days. During the secretory phase, right here, the uterus already has a functional layer, but now it's time to develop it and to prepare it for implantation. Uterine glands start to develop, and all that happens under the influence of high level of progesterone. So spiral arteries develop and they provide blood to the thickened stratum functionalis. It becomes much thicker, it has more blood vessels, it has more glands, it's ready for implantation of the embryo in case if the pregnancy happens. What happens if there is no pregnancy, if fertilization doesn't occur? Corpus luteum in the ovaries degenerates, and becomes corpus albicans, tiny white scar. Progesterone levels fall, and as a result, spiral arteries spasm. Remember, spiral arteries go all the way into the functional layer. Right now, functional layer doesn't receive oxygen and nutrients, and the cells there begin to die. That causes slowing of the functional layer, and bleeding happens. Effects of estrogens. Estrogens promote oogenesis and growth of follicle in the ovary. It also affects the whole body. It supports the rapid growth through the puberty, and it's responsible for developing of secondary sex characteristics like growth of the breasts, increased deposit of subcutaneous fat, hips and breasts, X-shaped figure, widening and lightening of the pelvic bones. Effects of progesterone. Progesterone works with estrogen to establish and regulate the uterine cycle. During the pregnancy, it helps to prepare breasts for lactation. Please stop the video and watch the animation Female Reproductive Cycle. You will find the link under the video. Now let's talk about mammary glands. Mammary glands are modified sweat glands, and each of them is made of 15 to 25 lobes. That's one lobule. Areola is the central part, pigmented skin that surrounds the nipple, and the nipple is the very center. Suspensory ligaments attach the breast to underlying muscle. Here they are, right here. Those connective tissue membranes are suspensory ligaments. Lobules within the lobes, here are the lobules, tiny structures. They contain glandular alveoli, and those alveoli produce milk. So those would be alveoli, and each of them produce milk. Milk goes through the lactiferous ducts into the lactiferous sinuses, that's most a storage place, and then open outside to the nipple to feed the baby. We have to talk about breast cancer, which usually arises from the epithelial cells of small ducts. Main risk factors include easy onset of menstruation, like 10 years or before that, late menopause after 55 years old, no pregnancies or first pregnancy late in life, family history of breast cancer, and 10% of breast cancer happens due to hereditary defects, including mutations to genes BRCA1 and BRCA2. Detection and treatment of breast cancer. Well, 70% of women who develop breast cancer have no known risk factors listed earlier. And what is important is early detection through self-examination and mammogram. Treatment depends upon the characteristics. There are so many types of breast cancer, and treatment can include radiation, chemotherapy, surgery, and sometimes it's followed by radiation and chemotherapy. Please remember to answer the questions for Chapter 27, Part 2.4.